Okay, what happens when the aortic arches and the carotid baroreceptors are stimulated? Jeremy?
Sorry, what was that?
What happens when the aortic and carotid baroreceptors are stimulated? And I asked you because you said increased heart rate. The heart rate increases.
The arteries dilate too?
Huh?
The arteries dilate too? I remember reading that. Allow more blood flow.
I think it's just activation of the baroreceptors in turn initiates an increased heart rate and ventilatory rate, and may increase anxiety and pain. So I'm not sure about with significant pulmonary. I'm not sure about the dilation. Okay, so another thing is hypotension, decreased blood pressure. And I heard somebody say, what did you ask about hemoptysis?
It's blood when you're spitting.
When you're coughing up blood.
So does hypertension work? There's a valley.
And it could be from the block of blood and not getting enough cardiac output because actual blood flow's been stopped. But yeah, it depends on where the embolism's at, how much blood's being blocked.
So they're stimulated by not enough pressure, or by pressure, right?
They are stimulated by a drop. Let me just make sure.
Maybe that's what I'm thinking
Obstruction.
about. Okay, so that's what
If
I'm thinking.
obstruction of the pulmonary vascular system is severe, left ventricular output will diminish and cause the systemic blood pressure to drop. The decreased systemic blood pressure reduces the tension of the walls of the aorta and carotid artery, which activates the baroreceptors. And that in turn increases the heart rate. Okay? So this is just an example of the dead space that occurs with a pulmonary embolism, which is very important. What is the definition of dead space? So we have ventilation, but we do not have any blood flow. What is that going to do to the PaO2 as it leaves the as it leaves the pulmonary vein into the left heart? It's going to decrease the PaO2 because of venous admixture. Now, if you are able to notice problems with heart sounds, that could indicate a pulmonary embolism. I'm not real familiar with this right ventricular lift. Can be detected in patients with a significant pulmonary embolism, but palpating along the left sternal border, and it'll be a little raised area, but I'm not familiar with how to do it or exactly what to look for.
Well, so should we go out for the test or?
No. Okay, we know where the wheezing is going to come from. Where are the crackles going to come from? Huh?
Basic.
What's going to cause the crackles?
Edema.
This is pulmonary embolism.
Will there be secretions?
Secretions are in the airways. Coarse crackles can be heard in the airways. These are more or less fine crackles, and it's more from any atelectasis that develops because of the pulmonary embolism. Questions about the blood gases? Now, all of these parameters right here, the central venous pressure, the right atrial pressure, pulmonary artery pressure, pulmonary vascular resistance, which part of the heart is being affected to show elevations in these parameters. The right side. Okay? Because the problem is blood moving through the pulmonary system, and now the right heart's got to work harder because there's this blockage. Why does that say pulmonary edema? That's weird.
Well, the congestion caused by it, it would cause edema. Congestion from the right side.
Well, that would have to be from the left side. The left heart would have to be affected to cause the backup of fluid.
So you said that is supposed to say edema?
Should stay embolism.
It should say embolism.
Oh.
And there is a possibility of the patient developing pulmonary edema. Now, I don't know how well you can tell this. This is a CT scan. And see, whoops. See how nice and free flowing this blood is right here? And then when we get over here, this is a blockage of blood flow, those kind of gray areas right there. And this is the best test to identify pulmonary embolism, is the spiral CT pulmonary angiogram. I would know that. Do y'all know what it replaced? It replaced the ventilation perfusion scan.
Can you repeat that again?
Which part? The CT, spiral CT pulmonary angiogram. And CT stands for computed tomography.
And that replaced the what?
Ventilation perfusion scan.
Thank you.
You're welcome. So look on page 309 real quick. And look on the right-hand side, the computed tomography pulmonary angiogram is fast becoming the first-line diagnostic imaging tool to confirm pulmonary embolism. And the ventilation perfusion scan used to be like the gold standard, but it's rarely done anymore for this purpose. But you do need to know it for your TMC and for your clinical SIMS. So basically what happens with a ventilation perfusion scan is the patient breathes in some xenon gas, and then scinctophotos are taken. This is done in nuclear med. And then the patient has a dye injected or a isotope, a radioisotope, and then scinctophotos are taken so we can visualize the air on one, the ventilation part, visualize the perfusion on the other part. And this right here is the perfusion, and see these white areas? That means that there is a lack of perfusion in those those areas. And ventilation is pretty good. There may be something going on right up in there. I'm not for sure. But in your typical VQ scan, there will be an area of no perfusion, and ventilation will be fine. See these little areas right there? Those are pulmonary embolisms that are blocking off blood. And this is that catheter that goes to the superior vena cava and the right atrium, the right ventricle, goes up into the pulmonary, through the pulmonic valve and sits in the pulmonary artery, and it'll either sit in the right or in the left pulmonary artery. Okay, so as far as some management, there are different levels of heparin that can be used. There's fast acting and there's slow acting. The fast acting is going to be used in an acute situation in the hospital where the patient can be monitored more closely. And these are some name brands of heparin that can be used. And then in the home, there's a slow acting type of anticoagulant that is still dangerous but doesn't have to be monitored as closely as the fast acting. And warfarin, Coumadin, panwarfarin are typically home anticoagulants. And what's the difference between an anticoagulant and a fibrinolytic or a thrombolytic agent?